Hi, my name is Sharon Carriel. Today I am told about chlamydia complication. Definitions. Chlamydia is a common sexually transmitted disease. It is caused by the bacteria Chlamydia trachomatis. It can infect both men and women. Women can get chlamydia in the cervix, rectum, and throat.
Hi everyone, today we're going to look at another organism, chlamydia. Chlamydia exists in two interchangeable forms, elementary body and reticular body. It is an obligate intracellular bacteria. That means it prefers to exist within host cells. Chlamydia cannot make its own ATP and is known as an energy parasite. Chlamydia has a cell wall made of modified peptidoglycan, which lacks muramic acid. To help us understand the difference between elementary body and reticular body, let us look at the life cycle of chlamydia. The elementary body has the proteins required to bind to the host cells where it attaches. This elementary body then enters the cell through an inclusion. Inside this vesicle, the elementary body changes into the reticular form. Here, it replicates and starts to reorganize back into elementary body. Cell lysis causes them to spill out, where they then go and infect other cells. Elementary body is small in size as compared to the larger reticular body. Elementary body exists extracellularly and is the infective form of the organism. Reticular body is found intracellularly and is the replicating form. To replicate, the reticular body naturally has to be metabolically active, while the elementary body is metabolically inactive. Since the reticular body exists intracellularly, it has a fragile cell wall, while the elementary body has a rigid cell wall, so it can survive until it finds another host cell to infect. Chlamydia trachomatis is a sexually transmitted disease. In males, it is characterized by painful ejaculation, burning while urination, and testicular swelling. In females, it shows vaginal bleeding, unnatural discharge, and burning while urination. Both sexes experience painful intercourse, pelvic inflammatory disease, urethritis, and infertility. The serotypes involved are D to K, which is an easy mnemonic to remember if you just fill in two alphabets. In case of a mother carrying the infection, it can be transmitted to the child during the delivery. It causes inclusion blenuria, which is the secretion of large quantities of mucus that eventually infect the child. It can cause conjunctivitis and pneumonia in the newborn. Complications of this disease can easily be remembered by the mnemonic FIRD, where F is for Fitz-Hugh-Curtis syndrome, characterized by perihepatitis or inflammation of the peritoneal coating of the liver. This commonly affects females. U is for urethral syndrome, which also affects females and is characterized by discomfort during urination, iuria, and urethritis. R is for Reiter's syndrome, which is characterized by conjunctivitis, urethritis, and polyarthritis. Easy to remember by the mnemonic CUP, and it affects only males. Trachoma is an other form of chlamydia infection. Its serotypes are A, B, and C, which will help you remember all its important features. C is for chronic conjunctivitis, where the follicles get infected, leading to inturning of the eyelashes, which causes corneal scarring. Repeated damage to the cornea leads to B for blindness. Trachoma is the leading cause of preventable infectious blindness. This condition is mostly found in A for Africa. This disease is sometimes spread by flies and is also called swimming pool conjunctivitis. Another form of chlamydia is LGV, or lymphogranuloma virineum. It is an invasive STD characterized by painless ulcers and painful lymph nodes. The enlarged inguinal lymph nodes are called bubo, found only in males. In females, estheomone or elephantiasis of the vulva is seen. The skin gets stretched over these swellings and becomes thin, leading to a positive free test. Serotypes L, 1, 2, and 3 are associated with this form of infection. Easy to remember because they also start with L. For the diagnosis of chlamydia, it is important to remember that gram staining reveals no bacteria. Neutrophils are present, indicating pyuria. This is a common question that can be asked in the form of MCQs. Chlamydia cannot be cultured on inert media because it is an intracellular organism. For the treatment, we use azithromycin, erythromycin, doxycycline, and tetracycline. I hope this video helps you recollect all the characteristics of chlamydia. Please do like this video and subscribe to our channel.
Application in dentistry. Oral chlamydia, you may have soreness or redness in your throat or mouth. Most people with chlamydia in the throat or mouth have no symptoms. So, it is important to know what chlamydia is and to get tests for sexually transmitted diseases often. It is a common bacterial infection that is easily cured with antibiotics.
What is chlamydia? Did you know that chlamydia is one of the most common sexually transmitted infections in the world? Most people with chlamydia have zero or no symptoms. The good news is that it's easy to diagnose, treat, and prevent. Why should I care? Here are the problems chlamydia can cause: painful urination, discharge, inability to get pregnant, abdominal pain, and increased risk of HIV. How do I get it? Chlamydia can be spread through sexual contact, either oral, vaginal, and penile or anal. How can I prevent chlamydia? With the use of condoms, either vaginal or penile, dental dams, or through abstinence. Does the use of condoms guarantee I won't get chlamydia? Well, the answer is no, but it will greatly reduce your risk. What do I do now? Well, if you are or have ever been sexually active, it's important to get tested. You should get tested with every new partner and ask your partner or partners about their sexual history and insist that they get tested too. How do I get tested though? See, the good news is testing is easy and available to you as a student. Samples are drawn through urine or self-swab, depending on the tests being done. You can go to the UCI Student Health Center, check out their website, or see your medical provider to get tested. There's also free, anonymous, and confidential testing throughout Orange County. Please visit the OC Healthcare Agency for locations. Hashtag Know the Facts.
Pros and cons. Pros. Chlamydia infection can be cured with the correct treatment. It is important that you take all the medication that your doctor prescribes to cure your infection. When taken properly, they stop the infection and can lower your chance of future complications. This disease is also asymptomatic. Cons. It can cause serious and permanent damage to a woman's reproductive system and make it more difficult or impossible for her to become pregnant in the future. Chlamydial infection can also lead to an ectopic pregnancy, pregnancy that occurs outside the uterus, that can be mortal. Issue applied in Ecuador. In Ecuador, the prevalence of nasal gonorrhea and chlamydia is this age group in Signs. Most cases of infection with gonorrhea and chlamydia are symptomatic. It is necessary to implement a cost-effective method for screening and early detection of these pathogens. Conclusion. Chlamydia affects people of all ages, but is most common in young women. Many who have chlamydia don't develop symptoms, but they can still infect others through sexual contact. Symptoms may include genital pain and discharge from the vagina or penis.
Hello, I am Dr. Rachel Gorwitz, Medical Officer in the Division of STD Prevention at the Centers for Disease Control and Prevention. Although most chlamydia cases reported are among teens and young adults, any sexually active person can get this sexually transmitted disease, or STD. In fact, CDC estimates there are nearly 3 million new cases of chlamydia each year. People get chlamydia by having vaginal, anal, or oral sex with someone who has this STD. Most people with chlamydia have no symptoms, which is why the infection often goes undiagnosed. If symptoms occur, they may not appear until weeks after having sex with someone who is infected. Women with chlamydia may have an abnormal vaginal discharge or burning sensation when urinating. Men with chlamydia may have a discharge from the penis or a burning sensation when urinating. Even when a chlamydial infection does not cause symptoms, if left untreated, it can go on to cause pelvic inflammatory disease, chronic pelvic pain, or make it difficult or impossible for a woman to get pregnant. CDC recommends that sexually active women under age 26 be tested for chlamydia every year. It is important for both men and women to discuss their sexual history with their physician to determine if they should be tested for chlamydia. Chlamydia can be cured easily with antibiotics prescribed by a healthcare provider. Even after treatment, though, a person can be reinfected if they have sex with someone who has chlamydia. So it's important that sex partners are also treated. Learn more about chlamydia and other STDs at www.cdc.gov/STD.